Hi, my name is Dr. Ross Hauser. Welcome. Thank you for watching this video. I just recently got acquainted with an old friend, so I was coming into the office to do this filming, and a very handsome gentleman started talking to me, and he told me his story, and I think you guys will love his story. We get questioned on YouTube and different places about whether or not the effects of prolotherapy, the healing of prolotherapy, does it last over time? So Terry, why don't you just kind of tell your story, and you look good for your age. How old are you?
I just turned 71 in January.
And tell us what you did for your 71st
well,
birthday.
A little background. I'm a retired teacher and wrestling coach in Michigan for over 32 years, and also varsity football for 34 years, and
Thank you for
varsity track 36 years. So I've been in athletics my whole life, and even in college and in high school. And so God gave me a gift of strength, I would say, and I was able to do chin-ups as well as some other things. So all my life I've done chin-ups, and I've won a lot of contests, and some, if I don't probably know, high school kids won't be watching this, but occasionally there will be, for the presidential fitness awards, I'll be substitute teaching. That's what I do now, in gym class, and somebody else, I'll ask the young man, how many can you do? And say, 25 on a good day. And then his buddy might say to me, Coach, how many can you do? And I always say, more than him. So I have done contests recently, and this wonderful young man, he challenged me actually. And I said to him, his name was Ander. I said, Ander? He's a sophomore in high school. I said, do you have a girlfriend? And he looked at me, and now they brought 3 classes in and other teachers. Awesome. And Ander just looked at me, and I said, you know why, Ander? He said, no. And I said, because if this 71-year-old man beats you in this high school, you will never have a girlfriend. So he laughed. Anyway, I always do one more than they do. And so to your point, Dr. Hauser, I always tried to do my age for the wrestling team, and I did it up until age 51. I did 51 chin-ups. And on my 71st birthday, just to see, because I do them every day. I mean, I did 45.
Awesome. Wow,
on my 70th, I did 43, and I said, I must be getting soft, because I would have done 45. So on 71, I did 45.
Oh, congratulations. Now when I was there, because we haven't seen each other for like 10 years. Right. And then you started telling me your story. Now, yes. I first saw you about 20 years ago.
Yes, absolutely. So why
don't you tell why you ended up seeing me, and then were the effects of prolotherapy good?
Try not to be too wordy here. I had a situation, it's called tarsal tunnel. My calcaneal nerve bifurcated before the tunnel. And anyway, it was something really Prolo couldn't treat. But I went there for the pain management. But over that course, I had 2 other things. One, in 1996, wrestling, we had an optional start. My heavyweight jumped on me. I was in a kneeling position, and I tore the medial meniscus and had to have surgery. I didn't know about Prolo, of course, at that time. So the surgeon, back in that day, in 1996, he just removed the entire medial meniscus. And when I saw it, because it wasn't really feeling that good, and I said, why didn't you stitch it up? And he said, well, it was so torn. Okay, so I read the post-operative report. He scraped it out. So there's no medial meniscus in that left knee. So while I was seeing Dr. Hauser, and I read some of Dr. Hauser's books, and he talked about this regeneration of the articular cartilage, and I said to Dr. Hauser, while I'm here, maybe we could do something preemptive here, and let's do some of that. So I can't be exactly sure, but I'm going to say 5 treatments.
In what year was that? What year?
That would have been in 2002.
Yeah, so about 20 years ago.
Yeah, 2001, 2002, right in that area. Yeah. And so now let's fast forward. So my knee had never bothered me. It just hasn't. But here's the story. I needed a resurfacing of my hip for osteophytes. And okay, so I had that. top surgeon outside of Detroit, Michigan, Commerce Township, terrific guy. And I thought, well, I'm getting x-rays on my hip. Why don't I have them just take one on my knee in case because they were specialists in replacing the medial side of your knee. And so I just brought that x-ray with me, and he was a great guy. We were talking like we are now. And I said, doctor, could you take a look at my knee? And he took the x-ray, and I still remember him putting it up on that white screen. And he looks at me and he goes, Coach, what's wrong with your knee? And I told him the story. And he said, well, this is where you would have on the medial side, the bone on the bone. You don't have that. So that's when I told him about prolotherapy, and it, I can't remember the exact conversation, but that's what he and I both attributed it to. And my knee's perfect.
He actually said, there's nothing
his
wrong.
Quote, this is a quote.
Yeah.
He said, Coach, because his son wrestled, and that was our connection. He said, Coach, what's wrong with your knee? And then I told him the story. Because there wasn't anything wrong. And the other thing, Dr. Hauser, on this journey, back then the internet had just come out in actually 2000, 2001. Yeah, you're right. Yeah. And I was in significant pain with that tarsal tunnel. I ended up with a doctor out in Santa Monica, California, because he had this MR neurography where they could see the peripheral nerves. And while I was out there, he was head of Cedars-Sinai, the neurosurgery, and he did some tests on me, and he said, boy, you have cervical stenosis. And I wrestled and all that, and I got a little worried. And he said, I can't tell, you could go. Anyway, long story short again, while I'm seeing Dr. Hauser, I had probably a 3 of a 10 pain, so I could have lived with it. My grandpa would have in those days. And I told him, Dr. Hauser, and he gave me the prolotherapy in the cervical area of my neck. And I'm going to say 3 to 5 days later, that 3 was 100% gone.
Awesome.
Doctor, it came back, I would say, a year and a half later. And I went back to you again. You did the same procedure. That was, let's say, 2003. Now it's 2021. I have never had any pain in the cervical area of my neck. Zero, none.
I think what's also remarkable too is, and you know this to be true, things like ligament laxity, meniscal things, they're all progressive disorders. Yes. So in other words, it isn't just that the thing, your knee didn't progress, it got well and it stayed well for 20 years, then your testimony is to that, for 18 years. Yes. So most of the time, the healing from prolotherapy is permanent. And I always preface it by saying, as long as there's reasonable forces, reasonable forces. So if somebody's, does treatment on their neck and they are in martial arts and they keep smashing on their neck, well, obviously at some point it could get injured again. But barring crazy forces, prolotherapy can be lasting, and in many respects it can be curative, and that's obviously what happened to you, and we're just grateful to hear your story.
Well, doctor, that was one of the questions, because I don't know how long you've been doing Prolo, but I would think that was when
30 years.
Okay, so prior.
I started in 93.
But that was one of my questions. I said, how long do you think this would last? And you answered it just like you did right now.
Yeah.
And it's true.
That's awesome.
Yes, it is.
Thank you, my friend.
Good seeing you again.
Coach. Thanks for everything you've done for all those young people.
I enjoy it. Thank you.